Hi, if you have patients in the clinic who have barely any bone to work with, and if you are planning to place a narrow size implant in the molar area, you are asking for trouble. Instead of compromising, why not expand? I am Dr. Avantika Tripathi, oral and maxillofacial surgeon, course mentor Dentium. In this video, we'll demonstrate the use of RSKit by Dentium, also known as the Ridge Spreader Kit. This kit is a specialized tool designed to facilitate ridge expansion and bone spreading in cases with narrow alveolar ridge. It is especially useful in implant surgeries where horizontal bone width is insufficient. It allows for atraumatic ridge expansion, minimizes the need for lateral augmentation procedures. It is ideal for ridge width between 3 to 6 mm, creating space for implant placement without the need for bone grafting. Let's discuss the components of this kit. This is the saw used to give the surgical cuts. This is the round burr which is used to smoothen the irregular bone. These are the ridge spreaders available in 3 diameters. This is the ratchet adapter. This is the bone chisel which is used to expand the bone, and this is the ratchet. Let's demonstrate the use of this kit on this dummy model. It is mainly indicated in the knife edge ridges in the anterior and posterior regions where conventional drilling might compromise the buccal bone. Surgery begins with a mid-crestal incision, raising a full thickness flap to expose the alveolar ridge. This is a case of mandibular anterior region where I will be placing 2 implants by expanding the ridge. To start the ridge expansion, first of all we will give 1 horizontal and 2 vertical cuts with the help of this saw, and the speed for cutting is 1000 rpm and the torque will be 35 Nc. The cutting should be done with copious saline irrigation to prevent heat generation, and as it is a very sharp instrument, so good amount of surgical exposure is required before starting to use the saw. We'll start introducing it more deeply, gradually, and it has to be used with controlled hands. Now let's make the vertical cuts. The entire radius of this saw should be gradually inserted inside. Let's make the other vertical cut. After making the osteotomy cuts with the saw, we will use the chisel for expanding the bone. So the chisel has markings of 4, 6, 8, 10 and 12. We will introduce this chisel into the osteotomy site, and then we will start tapping the chisel with the help of mallet. Gradually we will see that the chisel is going inside. We have to insert the chisel till the depth required for placement of implant. Once we expect that the depth is reached, then we will slightly twist and we will slightly move and shake the chisel just to expand the bone. And then we will gradually remove the chisel from the osteotomy site. Now same procedure we will do on the other side. First of all, we will place the chisel and then we are going to hit the chisel with the mallet. We will see that the chisel is gradually going inside again. Once the depth is achieved, then we will stop the dhum dhum sound and then we are going to remove it by just twisting the chisel gradually. By twisting, we can see that the bone is expanding, the cortical bone is pushing outside. Now we will twist it more and we will gradually remove the chisel in this motion only. If the cortical bone is dense, then we have to use the Lindemann guide drill of 2.2 mm from the surgical kit, and after that we have to use the spreader drills. If the cortical bone is soft, then we can skip using the Lindemann guide drill and we can directly use the spreader drills. As the cortical bone is dense here, so we will drill with the Lindemann guide drill till the depth of the implant. So I will prepare both the osteotomies till the final depth with the help of this Lindemann guide drill. Now we have to prepare the osteotomy with the ridge spreader drills. They are available in 3 diameters and the markings are 8, 10, 12 and 14. Let's start with the first ridge spreader drill. Let's start the drilling process. The drilling has to be done at a very slow speed of 20 rpm and 60 ncm. The drilling has to be done with copious saline irrigation and it has to be done in clockwise direction. Once we feel that we have reached the desired depth, then we will stop and then we will change the motor setting to anti-clockwise direction. Now gradually we are going to remove the drill from the osteotomy. So it has to be inserted in the clockwise direction and it has to be removed in the anti-clockwise direction. Now we are doing with the second ridge spreader drill. Very gradually we will condense the bone with the help of these ridge spreader drills and we will see that the buccal cortical plate will splay slightly on the buccal side. Now we will remove this in the anti-clockwise direction. If the bone is soft, then after the third spreader drill, we can place a 4 mm diameter implant. But as the bone is very dense here, I am using a 4 mm diameter final drill for the preparation of osteotomy. After preparation of osteotomy, we are going to place the implant of 4 mm diameter. So first I will place the implant, position it, check the orientation, angulation, position and then I will start the motor and I will gradually insert the implant inside. Let's place the another implant in the osteotomy site. After complete placement of implant, I am going to put the cover screws over it and then I can fill the bone graft in the space between the two cortical plates. I will pack the area nicely and then I will give a good soft tissue primary closure. After this, the procedure is complete. Let's discuss the tips and precautions of using the ridge spreader kit. Always evaluate the bone density radiographically. CBCT is recommended. Avoid excessive torque. Never exceed 40 ncm. The bone should be hydrated adequately to prevent microfractures. If you feel the resistance while drilling, the irrigation should be used generously. Now let's discuss the advantages of RSKit. It is the minimal invasive alternative to bone grafting. It helps in minimizing the chair time. It helps in preserving the periosteum and blood supply. It is excellent to be used in narrow ridges in aesthetic zones. It's time to ditch the compromise and level up the implant game. The RSKit is a user-friendly solution for ridge expansion procedures. So if you have got a narrow ridge, don't stress it, just spread it. Thank you for watching. For more surgical videos in update, don't forget to follow and subscribe Dentium.